Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Happy Mother's Day to all the ladies who have tuned in. Tonight, we are talking about mother and child. If you are a new mother or have a toddler, you have so many questions which are unanswered. And especially since you live in a country where you may not have your parents or your relatives close to you. And to answer all your questions today, I have a very, very special guest for you. But before I introduce you to him, I would like to acknowledge the traditional owners of the land on which we are meeting tonight and pay my respects to their elders, past, present, and emerging. Meet my guest, Dr. Raj Khillan. Hi, Raj. Thank you so much for joining me tonight.
Thank you very much, Sreha. It's my pleasure. And first of all, I would like to say Happy Mother's Day to you
Thank you.
and Happy Mother's Day to all the beautiful, gorgeous mother who are listening us. Thank you.
Um, Raj, before we start with the questions, can you tell us a bit about yourself, please?
Uh, just in short, Raj, as you said, my full name is Raj Khillan, and I'm a pediatrician by profession. I work in Sunshine Hospital, which is more a John Connor Children's Hospital now, and I am the director of Western Specialty Center. So my area of expertise is like a pediatrician, being a child specialist. Mainly, I work on western side of the Melbourne, like Werribee, St Albans, and whole of the Western Belt, from starting from Geelong to Epping to Craigieburn, and I cover a few regional areas too. And I'm also you see my logo. See, I'm the president of Healthcare Awareness Society of Australia, which is a non-profit organization helping to create awareness about health issues, particularly in multicultural community. Thank you.
Okay. Um, tonight, Raj, we are talking about maternal health and, maternal and child health services. So, for parents who really don't know about it, can you tell us exactly what the service does?
All right. So first thing I would say, thank you very much for choosing a very nice topic, good topic on Mother's Day. And we are talking about mother and child health services. And this is, you can say, one of the Victorian public health system uh, services universally provided to all mother and children up to school going age, and free of it is provided as a free of cost universal health services for mother and children up to school age, and which is coming under the cater of, you can say, the council. So the services giving, it's coming from the top as a public health system but delivered by council based services. And basically it is to the make sure the well-being of mother and child in the early growing stages of life. Thank you.
Okay. So, Raj, when you say school going age, up to what age?
Yeah, I meant before school going age, not the school going
Before
age,
school going
before
age.
school going age, and that is means if the child is going to school at 5 years, that will disconnect the services. If a child
Okay.
is going to 6 years, then we'll disconnect the services. But it's a preschool services for children.
Okay. Thank you. So, why is it so important for mothers to use this service?
Look, take it in this way: the initial years of life for the child and for the mother also, they're the most important and the crucial year. Every week, every month, child is changing something new. When the baby is born, and when you see baby by between 2 to 4 weeks start smiling, at birth is not smiling, then start, as we go up, start sitting, start crawling, start walking, start talking. And this is the different stages of life. The child is developing the new milestones, so meeting the new milestones. So it is important for child to achieve that milestones. Every child should achieve that milestone, but certain children are not meeting that milestones. And as a young parent, as a mother, particularly if you are a first time mother, you're not aware of what is normal for a child, what is not normal for the child, when to see a pediatrician, when to see a GP, when to see other specialists, speech therapy, psychologist, occupational therapy, dietitian. And so these issues are picked up on time, and these issues are being tackled timely, and so that the child is able to achieve the standard milestones. Achieving the development of the child is at par with any other, what is the age expected, we are expecting from the child. So that's the crucial year. And if these crucial years are missed, this crucial year, the child, when he needed the right intervention, is not given at that time, that's the most likely to have a more long-term implication. So it is very important, if that's what we call as a early interventions. So early interventions mean the early started early during the more crucial years of life. If the child is not talking by 2 years, if we start the speech therapy interventions at that time, and that's a more likely the child may be normal down the track 5-10 years time. So if you start the speech therapy at 5 years or 10 years on, which is late, or it started at a school going age, then it is going to be very late for that child. So
Yeah.
that early interventions can make a huge difference to the child overall outcome in the development. That's one thing. Second thing, if we look into the weight of the child, like a growth part, yeah, whether the child is looking smaller or shorter than for the age expected, whether the child is the weight is gaining what we expect for that age, or gaining too much or too less, you don't know as a mother unless until weight is being checked at the regular interval. So to ensure the child is achieving the regular checkups, to pick up these points, early indicators where there's a referral is needed, is the most important part.
Thank you. Um, so, what should be the frequency of these visits?
Look, in general, we say the from the child perspective, there are around 10 visits are needed in whole. What it comes in a green book we talk about.
Yes.
Like that is the first visit is 2 weeks, 4 weeks, 8 weeks of age. Then it is at 4 month, 8 month, 12 months. So that's the six within 1 year. Then it comes to 1.5 year, 2 year, and 3.5 year. So that is the crucial developmental point where we expect the child to visit to the center, and the maternity child health nurses are having a very set standard of their training and what they expect for the child to do in this area on this age, and then they can take the appropriate action or referral depending upon what they see. If the child is not meeting that standard, what they've been told that these are the standard you need to see, they tick the boxes on the green books, or they're missing this area, these are the points, this is where you need to see your GP. So minimum 10 visits in a whole childhood,
Okay.
a preschool area.
So, Raj, you
But
talked about a green book. What exactly
yeah,
is a green book?
yeah, green book. I mean, look, it is. I would say, it's like a Bible of child development. Okay, which is the more very important part, and I encourage that every mother should take the child to maternity child health center and for this regular checkup, and that should be the initial point, and then listen to the outcome and any appropriate actions to be taken further. As I said, the green book is the one is it's the different the 10 points which I told you, the 10 visits which is needed. The 10 visits like a 2 week, 4 weeks, 8 weeks, 2 months, 4 months, 4 months, 8 months, 12 months, and then say as an ongoing basis. So each in this green book for each visit we have a separate page, and on that separate page there is expected developmental milestones written, and the maternity child health nurse will fill these milestones and then tell you what next need to be done. If nothing is needed, child is meeting all the milestones, she write, all is well. It's 2 week visit. I'll see you at 4 weeks. I'll see you at next at 8 weeks. Check the weight, head circumference, length of the child. Put it over there. I'll see you over there. But what which we did not talk about in the previously, it is not only the child health we are talking about, because the child health, the baby health is also dependent upon the mother's health. So postnatally, mother follow up about their own health, own medical health issues. Like, is the baby is breastfeeding? Does the baby have any feeding difficulty? Sucking, latching, not latching? Does this mother need a refer to lactation consultant for the health? Does the baby have any tongue tie? We need a referral to pediatrician to sort that out. Does this mom is having any postnatal other issues? Is she able to sleep well? Is she eating well herself? Is she looking after herself, her own mental health properly, so that she can look after the child well? So all these parts come in the green book, which is called the Bible.
So, this is a question I ask all my guests who come here and are in the medical field. Raj, what happens to women who come here with very little knowledge of English, um, comes here as an international student? Uh, do they have to pay for this service? Is it free for everyone across the board? What are the few things that they need to know? Because back home none of us have this. There is no green book. I don't think there is this concept of going to a maternal health nurse, getting your babies checked. We all went to pediatrician when our babies were born. Here it is a bit different. So what would you like to tell these ladies who say have come just less than a year ago and still getting their feet around and uh, learning new things, and then they fall pregnant, they have a baby, and they have nowhere to go?
Uh, Look, I would say first thing we should consider that we are lucky in a country where we have a very structured healthcare system, and certain things where you don't need to do, it will be system will ask you to do. Like, once the baby is born in the hospital, like if you see the majority 99% of the delivery in Australia, they happen in the hospital setting. Very few home delivery or water birth delivery happen. And every baby needs to be registered. So when the birth register come, that information from the birth register goes to maternity child health services automatically. So the hospital will tell you, okay, which council, which is the area, this is there. So I live, suppose, because I work in a Wyndham, very beside, so Wyndham Council is comes. The hospital will tell, okay, you have to go to the Wyndham Council. We will be sending your informations to the Wyndham Council area. So you will get an appointment. First visit would be in a 2 weeks time. So that will automatically, the information would be sent to the council for your next appointment. So either you will get, the appointment from the Wyndham Council. Somebody will ring you. If not, I would strongly encourage mother to give a ring to the Maternity Child Health Center and get the appointment. It is a free service to all the citizen and the resident of Australia. I'm not sure if you don't have the Medicare, whether you have to pay for it. From the financial aspect, I don't know. But my understanding, as the part of the public health system, at the basic council level, baby is born here in Australia, who is likely to be the citizen down the track in a few years' time. So these services would be free for them too.
Okay.
That's my expectation. That don't quote me if you've been
Yeah,
charged for that.
fair
Yeah.
enough. Language, biggest
Language,
stumbling block.
I don't think there is, again, I said the system works much better and asks you to do so many things. I don't think there is a language barrier here in Australia because we have the translation services. Face to face, if we can't have a face to face interpreter, then we can have online or a telephone interpreter, which we commonly use in my medical center and in any medical center. So we can have a telephone conference, and that services are available in maternity child health center also. I mean, with me, I'm lucky that I can speak so many languages. So it's always good if you can speak the patient's mother tongue, and what degree of emotions and cultural sensitivity what we can show in the same mother tongue language, which is totally different than the interpreter services we get. But at least we have the interpreter services. I don't think that is any way is a hindrance over here.
Okay. Um, Due to COVID, all the nurses and numbers are on the rise now. All the nurses and the maternal health workers have moved to the hospitals. What does it mean for new parents? A lack of maternal health nurses.
I'm, I'm glad you asked these questions. Actually, if you remember, there was a code brown was declared in February, early February, and when uh, there was a shortage of nurses was declared. This means that the code brown, and that's the time the services from the maternity child health center were directed, and it was declared that these services would be given only a to babies up to 6 weeks of age, and or it may be other certain selected group of people, those who are vulnerable or a vulnerable group, only those will get the services. Otherwise the routine services will not be provided, routine checkup was not provided. So COVID has definitely caused a big disruption, and that was happened Victoria wide, and all the maternity child nurses for all the councils, and almost all the council services came back in April, except Melton and Windham, which is an unfortunate story. And that's how I talked on ABC TV, on ABC radio also about these nurses need to be come back, because already our this group, maternity and child health group, has suffered a lot during COVID, because they hardly had any face-to-face,
That's
interaction.
right. Yes.
Many things are already been missed in babies and in mother, and they were already suffering a lot. Now there's a time when the things are open. We can have the opportunity to pick up those things which was missed in last 2 years. So at least we can start giving a services for them, and then not starting services by the maternity child health nurses. It means a lot. That means these kids, these mother are continue to suffer for longer, and the many diagnoses can be missed. And
Yep. I
that
was
may
going
be
to
the
ask you that. Yes.
diagnosis could be of speech delay, autism, poor growth of the child, mom's own mental health issues can be missed for a long time, because the postnatal depression doesn't come in initial 6 weeks all the time. It may be later on when the family are actually suffering, when the dad has started working in back, maternity leave has finished, or sorry, paternity leave has finished, dad has to start work to make the earning, mom is left alone home with a little baby, she's not sleeping well, not coping well, there's no extended help is available, and that's the time the whole issues starts, and then start slipping into the postnatal depression, and these mother can be missed. So the missing of diagnosis, missing of this information for the vulnerable children is the biggest thing which I'm worried about.
So, Raj, with 2 years of total lockdown and children, mothers not being able to take their children to maternal health nurses, um, if you're a first-time mother, you have no idea what to do. Is there a way of catching up, or have they just lost 2 years of their child's development growth, not knowing whether the child has been developing okay? Because we all know that each child develops differently. There is no right, no wrong. um, but as you said, the green book and the maternal health nurses, they help, and I think they also put the mothers at ease, uh, you know informing them what is expected, what they should do, what they shouldn't do. And especially in the last 2 years, we haven't had family coming to help us, and for many of us mothers, we always had our parents and especially our mothers come to help us during this very, very difficult time and a new phase in our life, which we are so unaware of and so unused to. So, what happens then?
Look, let me just tell you first about my few experiences what I had in my clinic. The 2 year or 1.5 year child come to my clinic. As you enter, the child enters in the clinic, starts screaming and crying. There's a hardly any way you can engage with the child, smile with the child, play with the child. He is running away and want to leave the room and screaming. Did not let me talk even. And both parents were apologetic and asking, I'm so sorry, he's a COVID baby. You understand what I mean to say? COVID baby. So that means COVID, this is a COVID baby, it's a COVID child, who's born during the COVID time, suffered through the whole 7, 8 lockdowns, never went out, never went to childcare, mother, parents young, inexperienced, anxious. I don't want my child, my baby to catch cold or COVID. So kept at home all the time. And that delayed the psychosocial development of the child. So child has never had any opportunity to socialize anybody outside that house or in the apartment where they're living. So you can imagine you three member in the family for 3 years or 2 years, you are not seeing any other face. That's what typical COVID baby or COVID child is. So this is what the social anxiety is happening, and this COVID has caused social delay and social degeneration. I would say has happened even in older children or even in adult. There's so many adult also parents. I will say they are not ready to leave home because been getting used to that. Sitting at home, I'm very good talking on screen, but I lost my social skill of how to greet people, how to give a smile. We
Yep.
haven't used these words for many few months. So that's which is the biggest thing, because that was the age when the child was developing the social skill. Physically maybe running around at a 1.5 year, but the child socially hasn't developed to that level. So this is the biggest thing we are missing in this COVID time, social anxiety. And then you
Sorry, Raj,
rightly,
before, how would you define social anxiety in Hindi or in Punjabi?
uh, it's very hard for me to say social anxiety in Hindi, to be honest. Excuse me for that.
Um, how about give an example?
एग्जाम्पल इज एज ए सेड लाइक जैसे हिंदी में जैसे आप ये कहते हैं कि कुछ पेरेंट जैसे आके बोलते हैं ये बच्चा बहुत शाई है, हम्म, किसी के पास जाता नहीं है, किसी के साथ बोलता नहीं है, बाहर जाता है तो हमेशा रोता रहता है, उसको घर जाने की रहती है, या माँ की गोद में हमेशा चिपका रहता है। कहीं कहीं कोई दूसरे बच्चे ने अगर कई बंदे ने अगर उठा भी लिया, कि जैसे आप किसी के घर में जाते हैं, बेटे को बच्चे को उठाते हैं, so then this child will start crying. So that is the social anxiety.
Thank
Social
you.
anxiety is it's normal in certain age. When the child is around 8 9 months of age, social anxiety develops at that age, where the child start recognizing who is my parents, who is close to me, and who is outside. 4 months old baby will go to anybody, but 8 months old baby will not go to anybody.
Yeah.
Okay, so that we need to see at what age it's normal and what age it is not normal. So when by 12 months, generally that start easing out if we are giving a more social exposure. If we are not giving a social exposure to the child, we are not giving that opportunity to the child, what's going to happen is going to be more and more clingy to you, clingy to the parents, as not going to go out anywhere. And that can continue in later on in life. What I wanted to touch base, I mean, I must, thank you for that. You asked very cultural based question about our multicultural Indian subcontinent, a families, traditionally when the baby is born, generally grandparents, particularly from the mom side, mom, the maternal grandmother comes home, and they go to maternal grandparents' house, and the baby is born over there. So the baby's been looked after by experienced people.
Yes, and the mother gets rest. I know my mother came for both my girls. I mean, I could never have done without her.
Exactly. That's what the people here, the young, inexperienced single mom or first time parents couple, they were suffering here because they were relying on their parents, or at the usual the tradition here in my experience, what you say, 6 months, boys parents, 6 months girls parents, they come and help the family to keep going in that way. And that was 2 years they suffered in that way. They didn't get any visa to come over here because of the COVID. And that the traditional family help, what they were getting, that was missed out. So first thing was the help. Second thing was the knowledge. Well, like one is the physical help you're getting, so the mother can get help. It can get rest in terms of doing the household works. Second thing was maternal grandmother or paternal grandmother, they carries a wealth of knowledge from their experiences of life. 2 children, 3 children, 4 children, they reared up, and over the town, maybe other grandchildren. So they have a wealth of knowledge. So that wealth of knowledge being missed. So there were nobody who can share the experiences. No, beta, aise nahi aise karo, aise nahi aise karo. So that there was nobody to help them out. So these poor parents, inexperienced parents, young parents, they have no idea what is normal for this baby, what is not normal for this baby. When to ask for help, when is not to ask for help. And maternity child health nurses were also not available on a face to face. It was all telephonic interview. So that caused a lot of damage in terms of the social development of the child, and also the overall holistic wealth and health of the family. And when I talk about the holistic health, I'm talking about more the mental health. So I've seen in my clinic, mother mothers, those who are not sleeping well at night. And why? They were worried about, is my child waking up? Is my child breathing well? Oh, is 4 hours is not waking up, or baby is not waking up. I need to feed this baby. So that has caused a lot of anxiety among them.
Anxiety. Yeah.
So I think that is still an ongoing issue, and that social delay and the neglect of the mother's mental health has a long-term implications too, which we will keep saying, I will say, probably for a few more years. The bonding was the mother-baby bonding was disrupted during this time.
Um, I would like to actually, I wanted to ask you about development milestones, but I think what I want to ask you first is what I read a lot that young moms put up on various Facebook groups that I'm part of. Um, so, new mothers with one of the things that they talk about is that when their child is very sick and they take their child to the GP doesn't refer them to a specialist. And what should they do in that case? Because what is happening is, because borders have been closed, they have no one to ask questions, so the ladies ask these questions to random strangers, and everybody comes up with their own little, ye karna ji, wo karna, ye mat karo, ye karo. I mean, some things are, when a child is teething, it is going to have diarrhea. We all know that. We've all been through that. Development for each child is different. But I think one of the things that really stood up for me was that uh, one of the ladies took a photograph of her son's thigh, and there was this big red mark, and she said she'd taken him to the GP, and the GP was like given some ointment and said it's going to be fine. And I think 2 weeks later nothing had happened. So in such a case they were worried that the child should have been referred to a specialist? How do they go to, say, someone like you? You're a pediatrician. They can't come directly to you. They have to go to you, come to you through a GP. So, what is the right way, and how do they talk about it to their GPs?
It's a very tricky questions you are asked. Of course, this is the let's take it in this way. The first point of contact is always a GP, and and GP would be, looking at the chart and examining the chart and give you the right advice or the best advice based on their skills and knowledge, and which definitely is variable, and there is no doubt about that. But what I always give a message to all my patients and mothers, and in fact, and today again I want to give the message. As a mother, you know your child the best. You live with your child 24/7. Even as a pediatrician, based on my 25 years of my experience of working in a pediatric, I may not be that best with having a what you call is your gut feeling, your mother's sixth sense. That only you have as your mother. So follow your sixth sense. If you think even you've been reassured by your GP, by your pediatrician, and you feel, this is my baby who used to be normal or my child used to be normal, now is not himself or herself. Go back to your GP. Go back to your GP again and raise your concerns. Look, I not in a confronting way that I appreciate, but I'm worried. I'm worried about my child. I would appreciate if you can give me a referral for a pediatrician. And I don't think any sensible GP, once you go second time or third time, if your concerns are genuine, would any GP will say no for that. Yes, the system is you can't see a pediatricians directly, but there are few patients we do see directly, not many. The seeing pediatricians directly, the only thing you're missing out is what money you get back from Medicare. Suppose, for example, what I charge an X amount of money for in my consultation in private, two-thirds you get back from Medicare.
Yeah.
And if you come to me without referral from a GP, I will still be seeing you, but you don't get that Medicare money back.
Yep.
You will still get the same quality of care. You will still, your letter would be referred, so that letter would be sent back to your
GP.
designated GP,
Yep.
who you designate, so the continuity of care can be given from that point. So you will not miss out any care at any stage. The only thing you're missing is a financial aspect of getting
Yep.
money back from Medicare. And there are few patients, those who say, look, I don't bother about Medicare rebate. I want to, see you
Yep.
ASAP because I was getting into the system, getting lost in the system. So I don't bother about the money. So there is a way you can get directly. Similar thing is with the private health also work, those who have a private health insurance. Then other part, talking about advice from random people. No, the problem with our uh, culture sometimes is everybody's doctor in everybody's house. We give free advice without asking even. And, uh, and when it comes to your own health, then you run to doctor. But for someone else, we give very big advice every time. Whether I have expertise or not, I will give advice to X, Y, Z. You should do this. You should this.
Because
You should
advice
have,
is free.
you would have done this thing. I'm sorry to say, I'm part of that culture. I'm part of the culture, and
All of us are.
I'm a proud of my culture in many ways. I'm not criticizing my culture. I'm a very proud Indian and proud of that culture. We have so many good things, but there are areas where we need to improve. Definitely, we need to improve. So wherever we should ask for help, as I said in my previous question you asked, grandparents generally have a wealth of knowledge. and have full good experiences of life. So always see who you are asking for advice. Like I say, there are certain so many support groups. Like I see so many children with autism in my clinic, and I always say link with other parents. So if you have a child with a similar problem going in your family, you have a lot of experience. You can share your journey. You can share your experience with other that might be applicable for other. But if I'm a young parent I don't have my children my own, and I give advice to another couple who has just a newborn born, that you need to think about, is the right person I'm asking with. No, my uncle son has the same thing, or my other friend son has the same thing. He did this thing. You should do the same thing. That's the area which I would say is better to avoid. Use the information from the right person, from the right sources. And that's why instead of asking the random people, that's why the maternity child health center has 24 hours helpline available. So you can ring them. So this is also part of the maternity child health services 24-hour helpline.
Raj, I wanted to talk to you about children's development growth, but I think we'll leave it for next month and looking at the time. Um, One of the most important things that you and I talked about is mental health and the neglect, whether it's neglect of a child, whether it's intentional or unintentional, postpartum depression, that is a mother's condition after birth, and postnatal depression, which for our viewers, which relates to the baby. So these are the things I wanted to talk to you about. I'll let you choose whichever one you want to talk about first, because we've talked about the baby. Now I want to talk about the mother. What is it that the mother should be looking after? And we never ever talk mental health because there's such a stigma attached to it. We don't realize that it is very normal to have postnatal depression, the feeling of utter helplessness when a child is born because we don't know what to do. um, I think the feeling of anger and everything else that comes in because we haven't had enough sleep, we are tired, the child has is taking up, let's say, literally 26 hours of our day. I mean, we hardly get any time. I had to change my sleep cycle when my daughters were born because I was going to work, and they were up all night, and it was terrible. I mean, now I can laugh about it, but I know for a fact that I couldn't talk about it. I could only tell my mother that I was going through these, all these feelings. And I doubt even now if women are talking to their mothers or anyone else. Can we talk about that, please?
I'm sure. I mean, thank you, for raising this question. Very valid and very important question about maternal health, mother health, mental health, particularly. And I think which is a very pertinent question for our multicultural community, Indian subcontinent, which is the most ignored part. And let me divide into two part. I would say one
Yes.
is those who are already existing mental health issue before delivery or before pregnancy. That's a little bit of a different, you can say, vulnerable group and at risk group. And for that, maternity child health services has a separate program. What is called is enhanced maternity child health services. So under the services, there is a three-part comes. One is a universal maternity child health services, which everybody gets. Then second is enhanced maternity child health services, which is vulnerable group get, like a child whose baby is born premature or some other medical conditions or surgical conditions baby is born, or at risk of domestic violence, mother's mental health issues already known. So they do get a special care and more frequent visits and extra visits from other staffs too. So I will probably, because we don't have that much time, I will not talk about that part. But The talk about which is more relevant to our community is the postnatal depression and their own mental health, which the most ignored part. Postnatal blues and postnatal depression is a very common thing. Around, you can say it's around 15 to 20% mother they have. It's such common thing. Crying for little things, be getting emotional on small little things. And then, as previously as I said, it can keep getting worse and may not be evident in the initial 6 weeks. So maternity child health nurses are trained to pick up this postnatal depression. There are certain questionnaires to ask, and then scoring they do, and on that basis they decide, all right, you're going into that phase, you need to see a mental health nurse or psychologist or maybe psychiatrist or to via GP and get the thing sorted out. But that mental health is missed because of our cultural and traditional. First thing is because of the stigma attached with that mental health. Or I cannot not be depressed. Or what if somebody ask me, so you have a mental health issue, so it means you are not capable of looking after the baby. Okay, what my extended community is going to think about me, what my family back home will think, or extended family will think about me, because we start caring more for our society and our extended family than our own baby. And that's where these things start falling apart. Taking it in this way, if you are mentally healthy, physically healthy, you can look after the baby well. So baby health would be well maintained. If you are sleeping well, you are eating well, you are taking breaks in between. As you said, you are be awake 20, working 26 hours out of 24 hours. That means how long you can work like this. Ultimately, you're going to burn out. And on the top of that is the baby is not feeding well, so then you're pumping every day, and since morning to evening you think about what I'm doing. I'm just pumping for giving an express milk to the baby, and then cleaning all the nappies and baby bath, and then eating. And on the top of that, if they have to do the household work also, because there's no extra help, and that becomes so exhausting by the time baby is 2 months, 3 months, because now baby's feeding start affected. Baby is why start affecting, because mom is so depressed, so anxious, not looking after, the milk supply drops down. And that's the time where we see most of the baby, they are not gaining weight. So baby is born at the 50th centile in the green book. By the time they reach to 8 weeks, they started touching 10th centile or 5th centile, or drop down by 4th. By 4 month, definitely drop down below the 5th centile. That is the sort of a we reach to now emergency situation where the child and mother both need urgent care. Both need to be either admitted in a mental health unit like a mother baby unit where we keep it, which we have in a very Mercy Hospital and few other places, or need to go to the sleeping school like a Twiddle Family and Children's Services. So important message from me here, that baby's health is very much dependent on mother's health. And when I talk mother's health, it is both mental and physical health. For that, mother need to learn to have the routine life. That means if she can go for a walk, if she can take a break of, like you have a chai chat and community, she can have a cup of tea with the friends. Can she laugh with them? Can she go for a maybe a gym activity? Is she having a good food, eating all the time, and she's sleeping well? Is dad is taking over some part of the care, not only mom's responsibility, dad is also taking 2 hours, 3 hours a day and giving a break to mother so that she can take rest and sleep well, uninterrupted sort of a sleep rather than interrupted sleep every 10 minutes, 20 minutes looking after the baby. So this is the good way to look after yourself. And if you think Your baby is not doing well, not sleeping well, baby is not gaining weight well, you are not able to sleep well, you are not coping well, contact maternity child health nurses or your GP to seek for early help rather than wait. That's the
And there
message.
is no shame in that. Absolutely
Yes.
zero shame. I mean,
Yeah. Why it is
25
shame
years
when
later,
when
I can talk about it openly as to what I went through. I couldn't before, but I think it's time.
there should
Times
not
have
be shame,
changed,
Sneha.
and we should be
This is
able
the
to.
message I want to give. There should not be any shame. When you have a cough, cold, tonsil, viral fever, temperature, you take, to take Panadol, you take antibiotics. In the same way, if you have a postnatal depression, doesn't mean you're going to be having a significant mental health issues for the rest of your life. There should be no stigma, no taboos attached with this. More openly we talk about, more high the chances you will get out of it early. We need to talk about this.
Thank you, Raj. This has been an amazing, amazing conversation. Thank you very much for your time. We are bang on time. We said 30 to 45 minutes, and we are on 46 minutes. So this has been perfect timing. Next month, we are going to talk more, and we'll talk development and other baby and mother stuff. Thank you for your expertise, your time, and thank you for coming to Chai Chat and Community.
No worries. It's always my pleasure. Thank you very much.
Okay, good night. Good night, everyone. Thank you for watching. Take care and be safe.